Hello, this is Dr. David Greene, CEO of the California Pain Network. The topic today is the top 10 ways to avoid the need for a joint replacement. A few facts on joint replacement. Over 1 million joint replacements are performed every year now in the U.S. Hospital stays entail anywhere from 2 to 4 days. For the knee, the average age of replacement is 70 years, and over half are women at 60%. The infection rates now are around 1 to 2%. There is a slight risk of blood clots. The satisfaction rates are high, 90%. It's not 100%, but 90% is pretty good. 85% of artificial knees still work after 2 decades. The facts on joint replacement: it is a quality of life procedure. Nobody has to have one. It's not like an organ replacement where you may die waiting on a list. It's a joint replacement. Nobody ever died waiting to get one. Because the implants don't last forever, it is advisable to wait as long as possible to undergo one. The implants are made of various metals such as stainless steel, titanium, cobalt chrome, ceramic material. Usually the socket, such as here in the shoulder, is made of polyethylene, which is a form of plastic. Treatment option number 1 to avoid a joint replacement is activity avoidance. If it hurts, don't do it. Or do it less. If you're playing golf 5 days a week and it's killing your knees, if you cut back to 3 days a week, maybe that won't be as bad. And for instance, if you're running, maybe switch to cross training because it can put less stress on the arthritic joint. Over-the-counter medications may include anti-inflammatories, Tylenol, glucosamine and chondroitin are available at health food stores, and those can be very helpful for pain relief. Then you get into prescription medications. There are topical prescription pain creams which work very well. There's high-dose non-steroidal anti-inflammatories which you need a prescription for, Celebrex, and then short-term opiates. Long-term opiates, bad idea for arthritis. But when the exacerbations occur, the opiates may be indicated for short-term relief. The fourth option would be a TENS unit. TENS units look like this. They're battery powered. They're about the size of an iPod. They have these foam pads which can be replaced that go over the area of pain, such as your knee, and they emit a slight electrical impulse which can change the way that your brain perceives pain signals. Number 5 would be weight loss. Less joint stress means less potential damage to weight-bearing joints. Losing weight with exercise may strengthen up the muscles around the arthritic joint, therefore lessening the pain that goes through the joint. There have been numerous studies. One just came out recently that was reported in Pain Medicine News about how mechanical stress across a joint leads to arthritis more often than otherwise. So it is a real thing, and weight loss can help a lot with decreasing those mechanical stresses. Physical therapy is option number 6. As mentioned, strengthening muscles around the joints can take pressure off of the joint itself. Modalities may include ultrasound, electrical stimulation. Stretching is crucial in these sessions. Option number 7, acupuncture. Several studies have looked at acupuncture for arthritic joints, and routinely they show amazing benefit. Time and time again. And it doesn't matter what joint you're looking at, whether it's the knee or the hip, all of them show that acupuncture actually works very well for relieving the pain from joint arthritis. Number 8 would be steroid injections. It's never been proven that steroids damage joint cartilage in humans. That is a bit of a myth or an unproven assertion because it was shown in small animals. And then it was not shown in large animals, and it's never been shown in humans. So typically steroid injections are given every 3 months as necessary for joint arthritis. Remember, they don't alter the disease at all. They're like a proverbial Band-Aid, but they're one of the better Band-Aids that we have. Option number 9 is hyaluronic acid injections. These are made from rooster combs, which is just a little tidbit there I thought you might want to know. Our joints do contain significant amounts of hyaluronic acid naturally. It's like the motor oil of your joint. The theory is that providing hyaluronic acid promotes pain relief, promotes formulation of cartilage, and can help with pain relief. The studies show 65% good to excellent results for 6 to 12 months, and then it can be repeated. All those formulations are about the same. Synvisc, Hyalgan, Orthovisc. They really have not been shown any differences in outcomes between the 3 of those. And option number 10 is very exciting. It's regenerative medicine injections. This may include PRP therapy, otherwise known as platelet-rich plasma therapy, and that's where you take your own blood, they spin it down in a centrifuge to get the platelet-rich component out of it, and then inject that into the problematic area, such as the knee or the hip, and it can help with pain relief and regenerating some potential cartilage. Stem cell injections are either bone marrow, fat-derived, or amniotic fluid-derived, which is from a consenting donor after a scheduled C-section. All three of these are showing amazing promise for relieving the pain from arthritis and regenerating damaged tissue such as cartilage as well. So really impressive, state-of-the-art. What are the outcomes with non-operative arthritis treatment? Most patients are able to delay or avoid the need for a joint replacement. While most joint replacements end up fine, there's always a chance of complications, and it is a true quality of life procedure. Knee injections, incidentally, show over 75% good to excellent results. The top pain management clinics in California are affiliated with the California Pain Network. There's multiple clinics throughout the state. Over 50 insurances are accepted with over 25 treatment options provided. Overall, the average success rates for pain relief and avoiding surgery are over 90%, and the pain doctors are board certified and award-winning. Visit us online today at californiapainnetwork.com, and then call us for more information and scheduling at 877-877-8556. I'm Dr. David Greene with the California Pain Network. Your pain stops here.